Most of us were raised to believe that regular checkups and medical tests are the safest way to stay healthy as we age. After all, early detection saves lives, right? But here's something your doctor may never tell you. After age 70, some routine tests may actually do more harm than good. In fact, research shows that nearly 40% of medical tests in seniors lead to unnecessary treatments, complications, or lifelong side effects. Even worse, most older adults have no idea they're being over-tested. And here's the shocker. One of the most common tests may account for 5% of all cancers in the US. That's the same risk as drinking alcohol every day. So today, we're breaking down 5 medical checkups you should think twice about after age 70. Backed by real science, explained in plain English so you can make safer choices for yourself or for your loved ones. Number 5. The bone density scan, also called a DEXA scan. It sounds harmless, a quick, painless scan that tells you how strong your bones are. But here's the hidden truth. Once you're past 70, almost everyone's scan will show some bone loss. That's completely normal, just like gray hair or wrinkles. But here's the problem. Many older adults are then put on powerful bone drugs like bisphosphonates. These medications can cause serious side effects, including jawbone damage, painful reflux, and even unusual fractures. And the benefit? Very small. Studies show that in women over 70, bone drugs reduce fractures by less than 1% over 5 years. Let me share a real story. Rose, a 76-year-old retired piano teacher, had a scan that showed mild bone loss, called osteopenia. Her doctor started her on bone drugs right away. Within 3 months, she had severe reflux and jaw pain. She couldn't even play piano. When she stopped the medication and focused instead on vitamin D, calcium-rich foods, and light-strength training, she improved. A year later, she was back performing on stage, with no fractures. The science is clear. After 70, lifestyle works better than medication for bone strength. Weight-bearing exercise, balanced training, vitamin D, and good nutrition can reduce fracture risk by 20% or more. A scan may give you a scary number, but don't let that number control your health. Number 4. The brain MRI for memory problems. It's normal to feel worried if you're forgetting names or misplacing your keys. Many doctors respond by ordering a brain MRI. But here's the truth. MRIs rarely provide useful answers in seniors with mild memory loss. Instead, they almost always show age-related changes, like small white spots or brain shrinkage that are completely normal. But once you see something labeled abnormal, it creates fear. That fear often leads to more tests, spinal taps, and sometimes even brain surgery, procedures that rarely improve memory. In fact, a large study found that in people over 70 with mild memory complaints, 86% of MRIs showed something unusual, but only 3% revealed a problem that could actually be treated. Take George, a 74-year-old retired engineer. He was sharp, but sometimes forgot names. His MRI showed white spots. He panicked, convinced he had dementia. He stopped driving, stopped going to church. But cognitive testing later proved his memory was normal for his age. With simple lifestyle changes, better sleep, hydration, and brain exercises, he felt like himself again. Unless you're having serious symptoms like seizures, rapid decline, or sudden personality changes, an MRI is rarely helpful. A cognitive screening test, a simple 10-minute paper-based exam, is far safer, cheaper, and usually gives a much clearer picture. Number 3, the cardiac stress test. This is one of the most common tests for older adults. You walk on a treadmill or take medication to stress the heart, while doctors monitor for blocked arteries. But here's the problem. After 70, stress tests have a false positive rate of up to 40%. That means nearly half the time, the test says there's a problem when there isn't, and false positives often lead to angiograms, stents, or even open-heart surgery. Procedures that carry serious risks in older adults, including bleeding, kidney damage, and long hospital stays. In fact, a major study found that more than half of stents placed after stress tests provided no survival benefit at all. Raymond, a 75-year-old retired mailman, went through this exact situation. He felt tired walking uphill. His stress test came back unclear, so he had an angiogram and a stent placed. But the stent didn't help because his fatigue wasn't from heart disease. Worse, the dye from the test damaged his kidneys, and he spent a week in the hospital. If you're not having classic symptoms like chest pain during exertion or shortness of breath with activity, a stress test may do more harm than good. Safer options include a resting EKG or a calcium scan, both of which give useful information with much less risk. Number 2, colonoscopy. For people in their 50s and 60s, colonoscopy is an important cancer screening tool. But after 70, and especially after 75, the risks rise sharply. The prep can cause dehydration and kidney issues. Sedation can affect memory and thinking, and the procedure itself carries risks of bleeding, bowel tears, and even heart rhythm problems. A massive study of Medicare patients found that in people over 75, colonoscopy prevented 2 deaths per 1,000 patients, but caused 20 serious complications. That's a 10-to-1 risk-to-benefit ratio. And many polyps found at this age are small and slow-growing, meaning they may never become dangerous in your lifetime. Take Dana, a 73-year-old grandmother who felt fine. No symptoms, no family history. Her doctor recommended another colonoscopy anyway. A small polyp was removed, but that night, her bowel perforated. She spent 9 days in the hospital and never fully recovered. That's why the U.S. Preventive Services Task Force recommends stopping routine colonoscopy at age 75. Safer alternatives include at-home stool tests like the FIT test. Simple, no prep, and still very effective. And finally, the number 1 test to avoid after 70, the full-body CT scan. These scans are heavily marketed by private clinics as peace of mind or part of executive health checkups. The promise is simple: catch cancer early. But here's the shocking truth. Full-body scans expose you to radiation equal to hundreds of X-rays, and studies suggest they may actually be responsible for up to 5% of all cancers in the U.S. Even worse, the scans often find harmless spots, tiny nodules or cysts, that lead to panic, biopsies, and even surgeries. All for something that wasn't dangerous to begin with. Marcus, an active 80-year-old martial arts instructor, took part in a private clinic's elite checkup. His scan showed a tiny lung nodule. He went through a PET scan and a biopsy. The result? Benign. But the biopsy collapsed part of his lung, leaving him hospitalized for 2 months. The American College of Radiology is clear. Full-body scans should not be used for screening in healthy adults. If you have symptoms, a targeted scan may help. But scanning the entire body with no reason is like searching for treasure with a landmine detector. You might find something, but the damage can be worse than the problem itself. So there you have it, 5 medical checkups that may do more harm than good once you're past 70. Modern medicine is powerful, but it's not perfect. More testing doesn't always mean better health. Sometimes less is more. The best prevention at this stage of life comes from lifestyle. Staying active, eating a balanced diet, getting good sleep, and keeping up with only the tests that are truly necessary. Before agreeing to any test, ask your doctor 3 questions. 1. What happens if this test finds something? 2. Will it change my treatment? 3. Do the risks outweigh the benefits? Your health is too valuable to waste on unnecessary tests that could leave you worse off than when you started. So take care of your body, live fully, and choose your checkups wisely.